Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Let us begin with a question. Why would a mineral, something so ordinary that it sits quietly in spinach, almonds, pumpkin seeds, black beans, and whole grains, have anything to do with mood? Do not answer too quickly. Slow down. Look at depression not only as sadness, not only as low motivation, not only as negative thinking, but as a whole body state involving the brain, the immune system, stress hormones, sleep, energy metabolism, and cellular electrical stability. Now ask the second question. How could magnesium possibly matter here? Magnesium is not a sedative. It is not an antidepressant in the conventional sense. It does not force happiness. Instead, it participates in hundreds of biochemical reactions, many of them sitting underneath the very systems that regulate mood: glutamate signaling, NMDA receptor activity, serotonin and dopamine pathways, inflammatory tone, cortisol regulation, sleep quality, and mitochondrial energy production. So listen carefully. Do not think of magnesium as a magic cure. Think of it as a missing stabilizer. Think of it as a quiet regulator that helps the nervous system stop running in a high-friction state. And when the nervous system is inflamed, overexcited, poorly rested, and metabolically strained, even a small missing piece can make a large subjective difference. Depression deserves proper medical care. Say that clearly. If someone has severe symptoms, suicidal thoughts, bipolar disorder, psychosis, or major functional collapse, get professional help immediately. Do not replace therapy, medication, or emergency support with a supplement. But also do not ignore a low-cost, biologically plausible, clinically studied support that may help some people, especially when used wisely and safely. Here is the central idea. Magnesium may help depressive symptoms because it acts at the intersection of brain excitability, stress biology, inflammation, and energy production. Why is that important? Because depression is rarely only one pathway. It is often a network disturbance. Magnesium touches several nodes of that network at once. First, understand the brain chemistry. Ask yourself, what happens when the brain's excitatory system becomes too loud? One major player is glutamate, the brain's main excitatory neurotransmitter. Glutamate is necessary for learning, memory, and normal signaling, but too much excitatory drive can become damaging. The NMDA receptor is one of the gates through which this excitatory signaling operates. Magnesium naturally helps regulate this gate by blocking excessive calcium entry into neurons under resting conditions. When magnesium is inadequate, that gate may become easier to overactivate, allowing too much calcium and too much excitatory pressure inside the neuron. Why does this matter for mood? Because excessive glutamate activity has been linked to neurotoxicity, stress sensitivity, impaired synaptic function, and mood dysregulation. Notice the elegance here. Magnesium does not simply boost a mood chemical, it helps keep the neural electrical environment from becoming chaotic. It acts less like a hammer and more like a circuit breaker. A review of zinc, magnesium, selenium, and depression describes magnesium's possible roles through NMDA antagonism, modulation of serotonin, dopamine, and noradrenaline, effects on brain-derived neurotrophic factor, sleep-wake regulation, HPA axis function, and inflammatory response. That is a wide biological footprint, and it explains why the topic keeps reappearing in psychiatric nutrition research. Now ask, how does stress enter the picture? Depression often travels with a dysregulated stress system. The hypothalamic pituitary adrenal axis, the HPA axis, controls cortisol patterns, when stress becomes chronic, cortisol signaling can lose its rhythm. People may feel tired but wired, sleepy but unable to restore, emotionally flat but internally tense. Magnesium appears to interact with this stress architecture. Low magnesium states may increase vulnerability to chronic stress responses, while adequate magnesium may help the body move toward calmer neuroendocrine signaling. Do not oversell this. Do not say magnesium turns off stress. Say it more accurately. Magnesium may help reduce the biological conditions that make stress feel harder to recover from. Now consider inflammation. Ask the audience, why do some people with depression feel physically heavy, foggy, achy, and drained, almost as if the body is fighting something invisible? One reason is that depression, in many individuals, is associated with increased inflammatory signaling and oxidative stress. Magnesium has immune-modulating properties. If low magnesium contributes to a pro-inflammatory internal environment, correcting inadequacy may remove one irritant from the system. This is where the story becomes practical. A person may not experience magnesium as, I took a mineral and my NMDA receptors changed. They may experience it as, I sleep a little deeper, my muscles are less tense, my headaches are fewer, my anxiety is softer, I have enough energy to take a walk. Those changes may look small from the outside, but in depression, small improvements can create momentum. Now move to human evidence. Do not rely only on theory. Look at clinical data. A PLOS-OWN randomized crossover trial tested magnesium chloride in adults with mild to moderate depressive symptoms in primary care. Participants received 248 milligrams of elemental magnesium daily for 6 weeks. The study found clinically meaningful improvement in PHQ-9 depression scores and also improvement in JAD-E7 anxiety scores. Effects were seen within 2 weeks, and the supplement was generally well tolerated. Pause there and ask, why is the 2-week signal interesting? Because many standard antidepressant strategies may require several weeks before patients feel clearly better. Magnesium is not a replacement for antidepressants, but if a safe adjunct can begin helping sleep, tension, and mood within a short window for some people, that matters. It matters especially for people who are waiting for therapy, adjusting medication, or trying to rebuild daily function. But be careful. The PLOS-OWN trial was open-label and not placebo-blinded. Say that directly. Open-label trials can overestimate benefit because expectations can influence symptom ratings. Still, the size of improvement, the crossover design, and the consistency across subgroups make the findings worth taking seriously, not as final proof, but as meaningful clinical evidence. Now widen the lens. A systematic review and meta-analysis published in Frontiers in Psychiatry evaluated randomized clinical trials of magnesium supplementation in adults with depressive disorder. 7 trials, including 325 participants, were included. The pooled results showed a significant reduction in depression scores compared with control, although the authors also noted important heterogeneity and variable study quality. Ask the obvious question. How should we interpret that? Interpret it with balance. The evidence is not perfect, but it is not empty. It points in a favorable direction. The better statement is not magnesium cures depression. The better statement is magnesium supplementation may reduce depressive symptoms in some adults, especially when low intake, stress physiology, poor sleep, anxiety, or metabolic strain are part of the picture. Now ask another practical question. Who might be more likely to benefit? Start with people whose intake is low. In the United States, dietary surveys show many people consume less magnesium than recommended. The NIH Office of Dietary Supplements notes that 48% of Americans in NHANES 2016 consumed less magnesium from food and beverages than their estimated average requirement. That number should make you stop. Nearly half the population may be under-consuming a mineral involved in mood-relevant biology. And here is a detail that often escapes routine conversation. Serum magnesium is not a perfect indicator of body magnesium status. The NIH notes that no single method is considered satisfactory for assessing magnesium status, and clinical evaluation may be needed alongside lab testing. So if someone says, "My magnesium blood test was normal, so magnesium cannot matter," respond carefully. Say, "Maybe." But serum magnesium can miss intracellular or functional inadequacy. Do not diagnose yourself, but do not treat one normal number as the whole story either. Now make it usable. How should magnesium be approached? Begin with food. Command this. Build the plate first. Add pumpkin seeds, chia seeds, almonds, cashews, boiled spinach, black beans, edamame, brown rice, oats, whole wheat, and yogurt if tolerated. Use food as the foundation because food brings fiber, potassium, folate, polyphenols, and steady absorption along with magnesium. The NIH lists green leafy vegetables, legumes, nuts, seeds, and whole grains as good magnesium sources and notes that refined grain processing can substantially lower magnesium content. Then consider supplementation only when appropriate. Ask, which form should be chosen? Do not choose blindly. Magnesium oxide is common and inexpensive, but it is often less well absorbed. Magnesium citrate, glycinate, chloride, lactate, and aspartate are commonly considered better options for many people, depending on tolerance and purpose. The NIH notes that forms dissolving well in liquid tend to be better absorbed, and that aspartate, citrate, lactate, and chloride forms tend to show higher bioavailability than oxide and sulfate in small studies. Now give a responsible plan. Start low. Do not begin with a heroic dose. Many adults use 100 to 200 milligrams of elemental magnesium in the evening, then adjust cautiously if tolerated. Pay attention to the word elemental. The label may say magnesium glycinate or magnesium citrate, but the important number is elemental magnesium. Do not confuse the weight of the compound with the actual magnesium content. Ask, how will you know it is helping? Track symptoms. Use a simple PHQ-9 score weekly if depression is mild to moderate and being monitored. Track sleep, bowel changes, anxiety, headaches, muscle tension, and morning energy. Give it a fair but limited trial, often 4 to 6 weeks, unless side effects occur. If nothing changes, do not keep escalating endlessly. Stop, reassess, and speak with a clinician. Now give the safety rules plainly. Do not use magnesium supplements without medical guidance if you have kidney disease. The kidneys clear magnesium, and impaired kidney function can increase the risk of magnesium accumulation. Be cautious with medications. Magnesium can interfere with absorption of some antibiotics and bisphosphonates. It may also need spacing from other medicines depending on the drug. High supplemental doses can cause diarrhea, nausea, and cramping. The tolerable upper intake level for supplemental magnesium in adults is 350 milligrams per day. This limit applies to supplements and medications, not magnesium naturally present in food. Now ask the question that matters most. Why might magnesium be especially valuable as an adjunct? Because depression often reduces the very behaviors that improve depression. When people are depressed, they may sleep poorly, cook less, eat fewer whole foods, move less, and isolate more. Low magnesium intake can then become part of a loop. Poor diet worsens biological stress worsens mood, low mood worsens diet. Magnesium-rich food and thoughtful supplementation can help interrupt that loop. Not dramatically for everyone, not as a standalone answer, but sometimes enough to make the next healthy action possible. And that is the key. Do not look for one giant rescue. Look for leverage. If magnesium improves sleep by 10%, muscle tension by 15%, anxiety by a small margin, and energy just enough to walk outside, those gains can combine. Depression recovery is often built from stacked advantages, so bring the message together. Depression is complex. Respect it. Treat it seriously. Use professional care when symptoms are moderate, severe, persistent, or dangerous. But also recognize this. Magnesium sits at a meaningful biological crossroads. It helps regulate excitatory brain signaling, stress physiology, inflammatory tone, sleep-related processes, and cellular energy. Human trials and meta-analytic evidence suggest that supplementation can reduce depressive symptoms in some adults, especially when intake is low or the nervous system is under strain. Now act wisely. Improve the diet first. Choose magnesium-rich foods daily. If supplementation is appropriate, select a well-absorbed form, start low, track symptoms, respect medication interactions, and avoid unsupervised use in kidney disease. Ask why before you take it. Ask how while you use it. Ask what changed after several weeks. Magnesium is not a miracle. It is a regulator. It is not the whole treatment plan. It may be one well-placed support inside a larger recovery strategy. Take care of your mind, take care of your body, and take care of one another. We are learning this together like a family around one table. See you in the next topic.